Hi everyone, welcome to MedGoto. Today we're going to be talking about another very important topic, which is hypoxemia. So we're going to be covering hypoxemia, or in other words, hypoxemic respiratory failure. And before we go into this topic, I want to encourage us, if you have not subscribed to this channel, I want to please encourage us to subscribe so that we can keep this channel alive. And we're going to learn a lot together. I'm going to be posting a lot of videos frequently so that we can all learn together. And also remember to put on the notification bell so that each time I upload video, you can get those notifications and you can be the first person or among the few, among the first individuals that will watch the video. So let's go to hypoxemic respiratory failure. So before we go to hypoxemic respiratory failure, let's talk about the function of the lung. I love the lung so much, which is why I started my discussion talking about the lungs, right? So number one, the lung helps with oxygenation. So it helps with oxygenation. Number two, it helps with ventilation. And whenever we use the word ventilation, basically it means removal of CO2, getting rid of that CO2. And these are the two major basic functions of the lung. Of course, the lung have other functions, like things like immunity, right? Helping us to fight infection, particularly that beautiful alveolar macrophage, right? And it also helps to maintain our body pH. So they take part in acid base, right? Maintaining our body pH. And of course, there are other function of the lungs, which is beyond this conversation. So we're going to focus more on these two major functions of the lung, which is oxygenation and ventilation. And when the lung cannot perform any of these two functions anymore, or both of them, then we say that the lung has failed. So hence comes the respiratory failure. So that patient has respiratory failure. And when we look at respiratory failure, right? Respiratory failure could be a problem with oxygenation, right? In other words, we're going to call it hypoxemia or hypoxemic respiratory failure. And by definition, hypoxemic respiratory failure is when there is decrease in the partial pressure of oxygen. So in other words, less than 60 millimeters of mercury. Or it could be problem with ventilation, right? So that means patient to be retaining carbon dioxide. So that to be hypercapnia. And with hypercapnia, they want to be increased in partial pressure of carbon dioxide, usually more than 45. And of course, if your carbon dioxide is going up, this can affect your pH, so it can make your pH to go down, which we want to talk about in our subsequent lecture. So patient can have hypoxemic respiratory failure or hypercapnic respiratory failure, and some patients can actually have both of them. So they can have both hypoxemic and hypercapnic respiratory failure. And of course, either of them or both of them can lead to hypoxia. So patient can develop hypoxic respiratory failure. And when we look at, so for the purpose of this conversation, we're going to be talking more on hypoxemic respiratory failure. So hypoxemic respiratory failure will also be acute. It could be acute, or it could be chronic. And of course, it can also be acute and chronic. So patient can have acute hypoxemic respiratory failure. And then when is it acute, right? if there's a sudden drop in the PaO2, right? So if the partial pressure of oxygen suddenly drops, right? So that will lead to acute, right? Hypoxemic respiratory failure. And as opposed to chronic, which is a gradual drop, right? Gradual drop in the partial pressure of oxygen. So that's usually leads to chronic. And of course, patients can have acute and chronic, whereby they initially they were having gradual drop, right? And now there's now a sudden drop. And then most of those patients, most of the time, the way I know patients who are chronic, right? Most of the time, they usually be on home oxygen. So they've been on home oxygen, maybe like 1 liter or 2 liter. So that means most likely they chronically needs oxygen. So most likely they have chronic hypoxemic respiratory failure. So having said that, let's move on to the next part. Let's talk about the manifestation of hypoxemic respiratory failure. How does it manifest? Let me take up this so that we can have more space. So we want to talk about, so we're going to manifestation, right? Manifestation of hypoxemic respiratory. So when I'm talking, whenever I'm studying and I'm looking at manifestation, I love to talk about manifestation based on the organ system, right? So how is it going to affect the lungs, right? How is it going to affect the brain? How is it going to affect the heart, right? And how is it going to affect the kidney, right? Of course, these are major organs in the body, although there are other organs. But most of the time, our patient normally manifest with these 4 major organs, right? So let's start with the lungs, right? As we're going to learn in subsequent video from physiology, right? When we start talking about other part of physiology, anytime there is hypoxemia, right? This hypoxemia can activate your respiratory center. And then once you activate your respiratory center, what it will do is that it's going to make you to start, it's going to increase your respiratory rate, right? So you know, which is what we refer to as tachypnea, right? Tachypnea. And then basically trying to make you to breathe more faster so that you can bring in more oxygen, right? Trying to fix the problem, right? So when you look at the lungs, so the patient, they have to be what? They have to be tachypnic, right? So they have to be breathing heavy, right? And the other thing that will also occur in the lungs is that whenever there is hypoxia in the lungs, right? It usually leads to what we call vasoconstriction. So we call it hypoxic vasoconstriction. So hypoxic vasoconstriction. And this hypoxic vasoconstriction is a kind of like a protective mechanism in the lungs, whereby there is the bad area in the lungs, right? There's hypoxic, there's vasoconstriction in that area so that we can push the blood to the good areas in the lungs, right? So it's kind of like a protective mechanism in the lung. But the problem with that is that when you're causing hypoxic vasoconstriction, whenever you clamp down the vessel, right, what happens? There's going to be increase in the resistance, right? So the resistance inside the lung is going to increase. So the pulmonary resistance is going to increase. And whenever there's too much of resistance, the pressure will go up, right? So this can lead to, so that will lead to increased pulmonary pressure. And that can lead to pulmonary hypertension, right? So if it's lingual too long, right? So if the hypoxemia is there for too long, that can lead to pulmonary what? Hypertension, right? So moving on to the brain, of course, if the brain is not getting enough oxygen, right, the brain is not going to function very well, right? So this patient can develop change in mental status. So change in mentation, right? And a change in mentation could manifest maybe as agitation, right? Or they can become confused, right? So let's move on to the heart, right? So in the cardiac system, so hypoxia, right, can manifest different way, right? Number one is patient can become tachycardic. They can have tachycardia. And what tachycardia means is increase in heart rate, right? And how does it occur? Like we just mentioned, right? So if there is hypoxic vasoconstriction and there's increased resistance in the lungs, right? So that means the patient can develop pulmonary hypertension, right? So the pressure in this area is going to increase, right? So because there's increased pressure, right, in this in the pulmonary circulation, that means the afterload is going to increase, right? So the afterload on this side, right, in the right side is going to increase. And then, of course, we know that afterload is the pressure we need to overcome for the blood to move from the right ventricle into the pulmonary circulation. So because of that increase in afterload, that will decrease the stroke volume from the right side, right? So the stroke volume, so increased afterload, so pulmonary hypertension leads to increased afterload, right? And that increased afterload, right, will lead to decrease in stroke volume, right? So which is the volume of blood that comes out with each contraction, right? And that can lead to decreased cardiac output, right? And then because of the decreased cardiac output, right, our body is going to compensate for that to be able to maintain that cardiac output, try to increase the heart rate, right? Because if we remember, right, cardiac output equals to stroke volume times heart rate, right? So if your stroke volume drops for no reason, your body will try to increase the heart rate to be able to try to maintain your cardiac output, right? So that patient will be tachycardic as a result of that. Another manifestation in the heart, right, is going to be, so whenever there is hypoxia, right, whenever there is decreased oxygenation of the cardiac muscle, right, it normally affects the relaxation. So the ventricle will not relax very well because we need ATP for the relaxation, right? So if there's no ATP, you can't relax the muscle, right? And if the muscle is not relaxing, right, so they become stiff, right? So they become very stiff, right? So failure to relax the ventricle, right? So here we're talking more about left ventricle. So if it doesn't relax, right, so that means that will impair diastole, right? And what's diastole? Diastole is when you are filling the ventricle, right? So when the blood are coming into the ventricle from the atrium, right? So that will lead to impairment of ventricular filling. And of course, that impairment of that ventricular filling during diastole is what referred to as diastolic heart failure. So that means those patients who also develop what? They can develop heart failure. So that's also another manifestation of hypoxemic respiratory failure. So those patients can develop heart failure, right? And which is one of the reasons why our patients, right, who have chronic hypoxemia or who have some underlying lung disease, right, when they develop symptoms of heart failure, right, most of the time we might consider putting them on oxygen because to prevent the progression of their heart failure, right? And that's why sometimes patients will have things like obstructive sleep apnea, right? Untreated sleep apnea, untreated hypoxemic respiratory failure, they can also develop heart failure, right? So moving on to the next organ or the last one, which is the kidney. Of course, kidney is also very sensitive to hypoxemia. So if there is no enough oxygen going to the kidney, right? So that can lead to hypoxic injury to the kidney, right? So that can damage the kidney, right? And then just some step one question: which part of the kidney is very prone to hypoxia? Very good, right? So the medulla, right? So the straight portion, right, of the proximal convoluted tubule, right? or the proximal convoluted tubule, and also the thick ascending limb, right? So those two areas, they are very prone to hypoxia, right? So the proximal convoluted tubule and the thick ascending limb, they are very prone to hypoxia. And of course, if there is decreased blood flow, this can also lead to, because if this patient develop heart failure, right, that will lead to decrease in stroke volume, decrease cardiac output, and that will also decrease blood flow to the kidney, right? So decreased oxygenation of the kidney, right, leading to hypoxic injury to the kidney, and because from the heart failure, right, increased pulmonary hypertension, decreasing the cardiac output, that will also decrease blood flow to the kidney, and that can lead to injury to the kidney. So a patient can develop things like acute tubular necrosis and so on and so forth. Right? So these are the manifestations, right, of hypoxemic respiratory failure. So we're looking for a patient that is tachypneic, right? Heart rate is going up, so there's tachycardic, blood pressure could drop, right? They are confused, right? Change in mentation, right? And of course, kidney number might be going up, right? So having said that, let's now move on to the causes of hypoxemic respiratory failure. So the causes of hypoxemic respiratory failure. So let's